Hello moms and welcome. Today I'd like to talk about general guidelines for the amount of milk babies need as they grow month by month. As your baby develops, their feeding patterns naturally change. The amount of milk they drink during each feeding gradually increases, while the number of feedings per day slowly decreases. One of the most important things to remember is not to overfeed your baby. As a general guideline, the total amount of milk consumed in a 24-hour period should usually not exceed around 960 milliliters. However, these numbers are only estimates, and every baby is different. The most important thing is to observe your baby's behavior, hunger cues, and overall well-being, and adjust feeding accordingly. During the first week after birth, babies have very small stomachs, so they usually drink small amounts of milk at a time. In the first few days, a newborn typically drinks about 15 to 30 milliliters per feeding. As the days pass and the baby's stomach capacity increases, this amount gradually rises to 30 to 60 milliliters per feeding. By the time the baby reaches about 2 weeks of age, most babies are able to drink 60 to 90 milliliters during each feeding, depending on their appetite and growth rate. Around 4 weeks of age, the feeding amount generally increases to about 60 to 120 milliliters per feeding. As babies approach 1 month old, many begin drinking 120 milliliters or more every 3 to 4 hours. This stage often brings a more predictable feeding rhythm, although babies may still wake at night for feedings. By about 2 months of age, babies commonly drink around 120 to 150 milliliters per feeding. As they continue to grow, their nutritional needs increase, and their feeding schedule may become slightly more spaced out. At approximately 4 months, babies may drink 120 to 180 milliliters per feeding, and they may begin showing longer sleep stretches between feedings, especially at night. When babies reach 6 months of age, many are able to drink 180 to 240 milliliters every 4 to 5 hours. Some babies at this stage begin sleeping for longer periods at night, and their overall feeding pattern becomes more structured. Once a baby is comfortably drinking around 240 milliliters per feeding, the increase in milk intake usually slows down because their stomach capacity has reached a more stable level. As your baby approaches the weaning stage,